welcome back. The topic today we are going to discuss is why some people complain pain even after gallbladder surgery. See, the gallbladder surgery is done mainly for gallstone, and we have seen the previous videos the causes of the gallstone and the treatment options and all, and the complications mainly. So first we like to say is the gallbladder removal surgery, that is cholecystectomy, is done when we weigh the benefits, the good and bad. The good is more, so that is why the gallbladder surgery is being done, because it's given some, it is infected or it's non-functional, it is because of the jaundice or gallstone pancreatitis. Because of the complications, we have done the surgery. So if you weigh the good and bad, the good things are much more and compared to the bad things. But why people come and say, even after 2 years, they come and say I have the same pain in the abdomen, I have the same complaints, I have a bloated abdomen, I have a heartburn, I have a diarrhea, I have an indigestion, certain foods I cannot eat. So they come with these complaints. This is called Post Cholecystectomy syndrome. That means up to 40% of the people can experience this. This could be permanent, this could be temporary, or maybe sometimes transient. But most of the time, it is temporary. It can be easily managed. And 10% of the people, it's very tough to treat and it's permanent. And what could be the reason? The first we divide this into 50-50. There is called 50% biliary, that is gallbladder, liver problem, and 50% non-biliary, that is some other reason. The first 50%, that is non-biliary, it could be some other problem, like suppose you have an ulcer, then you have the same symptoms as if the gallstone is there. So this could be an ulcer, or most of the gallstone diseases are very common around 40-45 years. So generally, because of the age, their digestive capacity will be very little less. So people think it's all because of the gallbladder surgery. No, it could be a natural aging. Because of the aging, the digestive capacity is very less. Or they may be taking around 40-45 years. Most of the people will be taking medications for diabetes, hypertension. So these medications can cause gastritis, drug-induced gastritis, and very importantly, thyroid medications, especially women. Thyroid medications, they will be taking an empty stomach for years together. So these thyroid medications can cause irritations, which can mimic as if you have the same problem. And this is over. Apart from that, a general, after the gallbladder surgery, they would have had some other medical issues, or they would have taken some other medication like painkiller, antibiotic, that would have caused gastritis, mimicking as if having the same problem. This is one part. The second part is the 50% is biliary part, or the gallbladder and liver related problem after the surgery. So this part is mainly because now the gallbladder has been removed and there is no storage bag. So bile is continuously secreted, and which enters into the small intestine. But of course, it's very small amount, but continuously it's dribbling into the small intestine, causing gastritis. That's called bile gastritis, or bile irritation in the small intestine. That can cause bloated feel, indigestion, pain, nausea, vomiting. All this can give you. And another main reason is the sphincter of OD. This is a sphincter, the valve mechanism, where the bile enters into the small intestine. When the valve mechanism is not working properly, either it's overactive or it's not functioning not properly, then again, the entry of bile is abnormal, causing these kind of pain, flatulence, or maybe diarrhea, bloated feel. All these things can happen. The other thing is microliths, very small, microliths, we call them very small stones, microliths. They can form in the biliary channel, through which the bile is coming. They can form small micro stones, small stones. They can also cause these kind of problems. The other one is, suppose the surgery is a very complicated surgery, or after very complication the surgery was done, and post-operative adhesions, the liver is adherent to the small intestine adherent to the stomach and to the abdominal wall. These adhesions also can cause these kind of problem. So 50 is biliary part, another 50 is non-biliary part. Okay. Now, if you go to the doctor and complain, he will ask you the questions, history, and he will rule out, non-biliary causes by doing history as well as endoscopy, ultrasound, blood investigations. Everything will be done so that we can come back. Will rule out, or we can separate it into biliary and non-biliary. And if it's non-biliary, most of the time, ulcer kind of treatment, the PPA, proton pump inhibitor medications, antacids, they can help. And biliary part, for if there is a microlith, there are bile acids, ursodeoxycholic acid, these kind of medications will be given. So the pain will be, or the symptoms will be cured. Or if it is, if nothing is working, then probably diet. Most of the time, diet is one main reason for these kind of symptoms that most of the people forget, because after 2 years they become very normal, they start eating everything. So first they should follow less fat, or even I can say very less fat diet, very important, and fiber rich diet. Suppose there is too much of fat, then these symptoms can come back. So less oil, less fat, less cholesterol diet, that is very important, plus fiber rich diet. The third very important thing is, instead of taking 3 major meals, it should be split into 6 times, so that the bile, whichever enters the intestine or stomach, touches the food rather than the intestine. So split your food into 6 times. So 6 times split the food, fiber rich food, less fatty food. This is very important. And apart from this, if some other reason, because of the tablet, or that's called non-biliary part, then if any medication will be given for the gastritis, like PPA drugs, which can cure. And very rarely, there are 10% of the people that have a very permanent, persistent problem, which usually can be managed first by all these, the food, lifestyle changes, food times, and the medications, all these things. Plus, sometimes they may rarely need counseling, kind of thing, then definitely help them. So, gallbladder, after a gallbladder surgery, the pain could be biliary or non-biliary, and each easily can be managed once the patient understands what's happening. And you have to go and see your surgeon or the gastroenterologist. They can give you the proper treatment. Thank you.